why don't we offer discounts? Please, can you offer a reduction? Please, can you offer a reduction in your surgery price? Nice question. Like it. Right. Well, we don't offer discounts, and there's two reasons for that. And one reason is very or relatively sort of straightforward, and that is that the BARPs, which I spoke about earlier, which are Professional Association, Plastic Surgery Association, does not allow it. We're not allowed to offer discounts as a fully trained plastic surgeon and a member of BARPs. So members of BARPs are not allowed to offer discounts. So that makes it easy. So we're not allowed to offer discounts. And the reason we're not allowed to offer discounts, so obviously there's a reason behind it, is because it is a medical procedure. So if it's right for you, it's right for you. If it's not right for you, it's not right for you. You shouldn't be making the decision based on money, and we shouldn't be coercing you or encouraging you to have a medical procedure by offering you a discount and say, look, if you buy now, you'll get a discount. That is not ethical in a medical sense. So that is quite simple. Now, the problem, I can safely say the problem with certainly plastic surgery or cosmetic surgery in the UK is there's a lot of people who aren't plastic surgeons doing it. They aren't members of BARPs. They are not bound by our professional association. So in the same way that if you have a problem or they act unethically, or if they act in a way that you feel is not appropriate, you can't go to BARPs. I mean, you could go to GMC. They should still be registered with GMC, but GMC is for sort of quite big issues. They might actually be a GMC might help with this, but they're not accountable to BARPs, because if you're not a member of BARPs, then they're not accountable. And so I'm aware that some places do these things where they'll say, book this month and you'll get a discount and things like that. But that is not BARPs members who will do that. And but there are people out there who are not bound by those limitations. Now, I have to say that even if BARPs didn't have that stipulation, I still wouldn't offer a discount, because it doesn't sit very well with me. I don't feel it is in keeping with the values of my practice, because I don't want to have someone who says, oh, discount for cash, what can you do? Do it for 5,000, I'll book today, and things like this. And then we say yes, and then someone else who is, just assumes that's the price, then pays, 6,000 or 5,500. Then that's not really fair. And when I say it's not fair, I know it happens in the world. People wheel a deal and get discounts on things, but anyway, I just don't think it sits very well with me, and I don't want someone to feel that you can do a deal. And it makes it easier for all the staff. It makes it easier for everyone in the office, because it's just like, look, really sorry, we're not really a price. We're not really a price driven practice, and patients who come don't really come because they're looking for a bargain. I think if you're looking for a bargain, you won't come to us, and you may feel a bit aggrieved. Oh, they're not offering a discount, and I understand it. I like a discount. We all like a discount, don't we? I like a discount, but it's not really in keeping with the brand and the way we do business. So I don't know. It's just what it is. It's just what it is. It's like Apple. And sometimes it makes it easier, it makes it easier to buy an Apple thing, because you don't have to trawl and look for discounts and look for, offers, because there's never going to be a discount. You just got to, you might say, look, that's a crazy price, I'm not paying it. Well, fine. I'm going to get, discount on, I understand that, and people will do that. And that's, that's the nature of the beast. If you don't do discounts, there are people out there who'll be aggrieved and want to feel that they've had a bargain and things. And as I say, I'm one of those people. You think, oh, wow, that's good. TK Maxx, love it. Home Sense, can't get enough. I'm there. So I totally get it as a consumer, but in terms of the business, it doesn't It doesn't sit right with the values of the business, nor does it sit right with the fact that we're members of BARPS and this is a medical procedure. So anyway, I hope that's okay. I don't know what's going on here. What's going on? Olivia's putting all sorts of emojis on. Nice one. Julia's in the house. I think the deal thing, apart from money, which is a huge factor, when you investigate procedures, the ones abroad do packages which are appealing, but obviously it's personal choice and safety. Yes, Julia, it is appealing, isn't it? I totally get it. I totally get it. And what I normally say to people is that we can't compete on price, and we do get people who ask about stuff and ask about price and say, flipping it, you can have it done at half the price over here or over there. And I understand that, and I would love to be able to compete on price, but we can't compete on price. And what we can do, and what I truly believe on a world stage, that we can compete on the value that we give, the service, aftercare. I believe that we can compete on that on a world stage. I think we can compete on a, with anyone in the world in that regard. And you can't have a service where you're competing with other services in terms of value, aftercare, experience, service, and competing on price. You can't do both. You can't do both. You can't be price competitive and service, value, aftercare, give the best experience to everybody possible. It's just not possible. So you have to, something has to give. If you're going to be competitive on price, something has to give. If you're going to be competitive on service, something has to give. So for us, we're competitive on service, and the thing that has to give is the price thing. So we will attract people who are attracted to a comprehensive service and will pay the price for that. Other people will be attracted to a much more competitive price, but perhaps, I don't know, you have to talk about those places, but perhaps the service will be less competitive, but they might choose that. So that's where we are on that one. But I totally understand that a competitive price is appealing. And I do understand that. If you go abroad, there's no aftercare whatsoever. Okay, unless you stay in that country for a few months. Right. Okay. Yeah. So says Olivia.